And so they will never release that information, but I'm going to release it to you right now.
Yeah, so we're releasing the information.
The laboratory at UP Diliman did testing on over 2,000 medicinal plants, and the two most effective anti-cancer plants they found were Guyabano leaves and Attis leaves in the Philippines.
I will tell you kasi when I went to UP, they were researching on Guyabano leaves, and they said that it's one of the, I can tell you quote unquote that they told me, and it was, you know, my husband was there as well, that Guyabano has an anti-cancer property. In fact,
what we basically, they were studying about 2,000 different medicinal plants there at the laboratory in UP. It was all pharmaceutically funded research. And so we'd ask them, what is the most potent anti-cancer medicinal plant you found? They said, well, it's Guyabano leaves by far. I said, really? I said, well, do you, when
and Attis, the next is
the next was Attis, which it's a sister plant of Guyabano. So I'd ask them, I said, when do you plan to release that information? They said, well, we're not. That's pharmaceutical funded research. They own the data. And so they will never release that information, but I'm going to release it to you right now.
Yeah, so we're releasing the information.
The laboratory at UP Diliman did testing on over 2,000 medicinal plants, and the two most effective anti-cancer plants they found were Guyabano leaves and Attis leaves in the Philippines.
This was when we were there, you know, when we were talking to a lot of the people there. So yun ho yung ginagawa nila by that time. So, you know, it's really good, you know, to know all of these things. Kasi especially if you do not have money, di ba?
That's right.
Kawawa ka naman. Kawawa naman ng Pilipino. They do not have any more money.
Well, that's what I would never tell them.
Yeah. So,
I mean, because the thing is, you have to, one quick segue, Mom. Look at, you have to look at the business of oncology, guys, of doctors who typically treat cancer. What they're looking for in order to pay their bills are sick people, sick and dying people. Now, if there are less sick and dying people, that means there's less of an income for someone like that. So understand, working in a field like that where everybody is just sick and dying and you need them that way, I don't want them that way. I'd rather everybody be healthy.
And I want you all to know this herbal medicine, especially for the poor. Kasi imagine mo, you're having diarrhea. Your 1-year-old is having diarrhea. Tapos, ang gamot is guava lang naman. 95% of diarrhea will stop by taking guava leaves. Ano? And wala kang pera, you don't have any money. Patay na yung anak mo, di ba? So it's really better for us to all know the herbal medicine. So, again, I told you about Guyabano leaves, okay? Dapat mainstay na yan. And hindi po totoo yung chismis, ano? Because they're saying
Please address that.
Yeah, they're saying that Guyabano can cause anemia, ano ho. Now, this is my take on that, ano? Especially when everyone is demonizing Guyabano leaves. I have used Guyabano leaves for 15 years already. Ano po, and some of my patients, they have been taking it for years. Ang tagal-tagal na. And some of them, they don't have anemia. Hindi ho sila, they did not develop anemia as a result of Guyabano leaves. But some, they develop anemia. But it's not because of the Guyabano leaves. It's because of their cancer. Kasi ang cancer ho, one of the symptoms is chronic anemia. Okay, pag may cancer ka, usually may chronic anemia ka din. Okay, so meron ka ding chronic blood loss. So lalo na kapag meron kang problem sa colon, ano, so minsan tumatay ka ng dugo, then you would have chronic blood loss and you would have anemia, but not really with Guyabano. So yung mga nababasa po ninyo, some articles that have been written about Guyabano leaves, well, you have to ask yourself who wrote it.
Who wrote it? You know, they're going to tell you that the Guyabano leaf is not good for you, but you can take this medication. Really? Can you please show me a medication, you know, an artificially produced medication that does not have a side effect?
Yeah, who wrote it?
Who wrote it?
Ask,
Where does the funding come from?
yeah, who wrote it? Tapos, clinician ba siya? Baka mamaya, hindi naman siya clinician. Now, na-demonstrate ba niya?
Exactly.
Was he able to demonstrate that Guyabano leaves? Because as much as I know, some people, they will not waste time on natural medicine, to debunk natural medicine. Majority really would, just leave it alone. Kasi hindi siya masyadong profitable. It's not profitable on their part.
Well, that's the biggest aspect of what Dr. Farrah is really about and what she's done, because first and foremost, she's a clinician. You know, she's not some formulator. She's not some expert, some guru. She was a clinician. You know, someone who was actually in the trenches fighting the battle against cancer and degenerative diseases for 16 years. You know, treating over 150,000 patients. So everything she does when it comes to her products, I want everybody to understand this. Everything she does is based upon that level of knowledge. That's 16 years of knowledge of seeing 150,000 patients, you know? And understand, when you're seeing that quantity of patients, you're able to really and truly define what your protocol is and how it works, and to really help people when they're following that protocol, when their health is improving. I have to be careful what I say here. You're able to get really good at it. That's what I'll say. You're able to get really, really good at it. So, for example, if you decide to golf and you swing a club 150,000 times, you're going to get pretty darn good at it.
Yes.
That makes sense?
Yes. Thank you, Sir Jack.